There are three main principles to coming off an antidepressant safely. The first one is to come off slowly, not quickly. And slowly often means for over months or years rather than days or weeks for long-term users. And that's because a longer period of time will allow your brain and body to readapt to the drug not being there rather than having its equilibrium disrupted too quickly. The second principle is you've got to go at a rate that you can tolerate. There are some risk factors that we recognize about how long people have been on the drugs for, which drug, and their past experience, but everybody a little bit different. And so there's a small amount of trial and error where you make a reduction, see how you adapt to it, and based on that, decide on the rate of reduction. If things become too unpleasant, people should pause, slow down from there on in, or go back a step or two, and then try to go down more slowly. And the third principle is that you need to go slower at lower doses, and this comes down to the idea of hyperbolic tapering, where it's easier to make reductions at higher doses of a drug and much harder at lower doses. And so you might start going down at 10 milligrams per month, but by the end, you may need to go down at 1 milligram per month. And in order to implement this in practice, people often need to use formulations of drugs that are different from what are available at the local pharmacy, for example, liquids or smaller dose formulations of drugs in capsule or tablet form to allow very small reductions to be made over time.